Sue, welcome to the Bedford Chiropractic Clinic. Now, you've never been to chiropractic before, have you?
No, I haven't, no.
You haven't, okay. Can I ask why you've never been to chiropractor?
I think I lead a fairly healthy lifestyle, so I haven't really ever felt the need to come along, so...
Okay, so at the moment then, do you have any aches or discomforts at all?
Not really, sometimes slightly achy shoulders, but I just tend to work that off, do a bit of exercise and stretching, and that seems to sort it out most of the time.
Okay, okay. And so you've sort of gone all through this time without any aches or discomforts or anything that's required you to go and see sort of a therapist of any description?
Yes,
yeah?
Really,
okay.
Generally fairly good health.
Okay. So, do you go to a dentist?
Yes.
Okay, and can I ask why? Why do you go and see a dentist?
Just for a check-up, really, to make sure that no problems evolve from neglecting my teeth.
Right, okay. So, you don't want to lose your teeth basically?
No.
Yeah, and the dentists obviously have sort of educated you into making sure that you go so that they can look after your teeth, or help you to look after your teeth.
Yeah.
Yeah, okay.
Preventative, really, I suppose.
Preventative,
yes,
yeah, absolutely. And what about a car? You have a car?
Yes.
Okay, and how often do you get the car serviced?
Once a year.
Once a year, okay. And how often do you use the car?
Every day, really.
Every day. So for how long every day?
Probably about an hour a day.
An hour a day, okay. And you get it serviced regularly?
Yes, yeah.
Okay. And how often would you say you use your body?
Every day.
Every day, okay. And that's not an hour, that's 24/7, isn't it?
Yes.
So every sort of millisecond of the day you're using your body.
Yes.
And even when you're sleeping, you're using your body. And sometimes, we put it into all sorts of awkward positions.
Yeah.
Yeah?
Mm-hmm.
So, would it not be an idea to get the body serviced, would you think?
Yeah, definitely. When you put it like that, it makes it seem that I should have been getting checked.
Yeah.
Yes.
Because the thing is that sometimes, things break down at sort of the most inopportune moments, don't they? When cars always break down when you're just about to sort of go for an important meeting,
yes.
and teeth will suddenly sort of start hurting. You'll wake up with pain, but you've probably never been aware of it. Just like you were never aware that the car was going to break down that morning, you weren't aware that your tooth was going to hurt that morning either.
No.
But then all of a sudden you wake up or you start the car and something's not right.
Yes.
Yeah?
True.
And the body, unfortunately, works in a similar way.
Mm-hmm.
Now, you've been very, very good in the sense that you haven't had any of those experiences, right? And you've mentioned the fact that you sort of keep a fairly active life.
Yes.
So what kind of things do you do?
I do yoga nearly every day, cycling, kayaking, swimming, so a good rounded regime, really.
Right, yeah, absolutely, and that's brilliant. And the fact that you're using your body is really good, and it's something that we actively encourage you to do.
Yeah.
But would it surprise you to know that by using your body the way you are, actively, you actually might be damaging it?
Yeah, I think so. I think you think you're doing everything like the exercise to help prevent any injuries.
Yes.
Yes.
Okay.
Right.
What I'd like to do today then, right, with your permission, is I would like to just explain a little bit about chiropractic to you,
yes.
right, and then if it's okay with you, I'd like to just show you sort of perhaps how your body might not be working as optimally as you might think it is at the moment. Is that okay with you?
Yeah, that's fine.
Yeah? Fantastic. Okay, so let's start with just explaining what is chiropractic.
Okay.
Yeah? Now, chiropractic is the study and the therapy and the treatment for the most important system in your body.
Mm-hmm.
So if I asked you, what's the most important organ in your body, what would you say?
Probably your heart.
Your heart, yeah? And everybody says that. It's surprising everybody says that, because we think the heart's really important, and of course it is, right? But what makes the heart work in the first place?
Basically your body pumping.
Your body pumping blood,
yeah.
Absolutely, that's what the heart does. But it's the brain. The brain actually controls the heart.
Yes.
So if your heart stops, right, there's a good chance that they might be able to start it, right, or they might be able to replace it,
mm-hmm.
right, and you'll be kept alive.
Yes.
So you could be kept alive. But if the brain dies, end of story.
Mm.
Yeah. So the brain is actually the most important organ in the body, and the brain, how that interacts with your body on a day-to-day basis, is what chiropractic is all about.
Okay.
That is what we look after. We look after your central nervous system.
Mm-hmm.
Okay? We're associated with back pain, neck pain, shoulder pain, hip pain, but actually what we do is much, much more than that. So your brain sits in your skull and physically comes into your body through that canal. And it's protected in your body by these 24 articulating joints.
Yes.
Yeah? And the spine is shaped in a particular way, and when it's in that shape, it's actually really, really strong. Yeah? But the sad thing is that most of us live with little, what we call subluxations. These are areas of tightness where the joint is slightly out of place, it's not moving as well as it should do, and there's some muscle tension around there.
Okay.
Now, in between each of these joints is a nerve, and that nerve is a continuation of the brain. Now, that nerve is really important because that nerve gives that area of the body, that muscle, organ, joint, tissue, life. It is what keeps it working. Yeah? And if that nerve gets in any way damaged or cut, then that area is going to suffer.
Yes.
Right? An extreme example of that is somebody who basically has a break. Right? And we know that from that breakdown, the person can end up paralyzed.
Yes.
Because the messages from the brain are not getting through to the rest of the body.
Yes.
Does that make sense?
Yes, it does. Yes.
Now, the other important thing that most people are not aware of is that that little tightness that you might not be aware of at that time, right, is creating wear and tear in the joints. So you could end up with wear and tear in the joints, which will then also be affecting the nerve. And by affecting the nerve, there are some long-term repercussions to that. Okay?
Okay.
So it's important to make sure that that joint is moving well, and thereby look after the nerve.
Okay.
And pain, please remember, Sue, pain is not the first thing the body gives you, it's the last thing the body gives you.
Yes.
So at the moment, it's great that you're not feeling any pain, but it doesn't mean that your body is not compensating for some tension, right? And it could be that tomorrow, you might wake up and, hey presto, you've got some pain. You may bend down, pick something up. You may get up quickly, and all of a sudden there's that sharp pain. And the sad thing is, Sue, is that I sort of, in 16 years of practice, right, I hear that every day from people who come and see me because they're in pain. When actually, if they had come to me a week or 2 weeks, or even a day before, we could well have prevented it.
Yes.
Yeah?
Yes.
If you sort of stand up with me, I just want to show you something on this board up here. Now, there was a very famous pathologist by the name of Henry Windsor. And what Henry Windsor did was he opened up 200 dead bodies because he didn't like chiropractors and he wanted to prove chiropractors wrong.
Okay.
And what he found was he found the most diseased organ in that body, and he followed the nerve supply back to the spine.
Okay.
Yeah, and in 196 of those bodies, what he found was he found that the more diseased the organ was, the more arthritic and fused the joint was,
Okay.
and more damaged the nerve was. So what he found was that there was a direct correlation between the health of the spine and the health of the organ.
Okay.
Okay, now that, if you think about it, it makes sense.
It does make sense,
right?
yeah.
Because the brain sits here and physically sort of sends the messages down to the organs,
Yes.
right, via the nerves,
Yeah.
and then the messages then can go back from the organs, back to the spine, back up to the brain.
Yes.
The spine is basically just like a substation, it's a
Yeah.
conduit, yeah? Where the messages go backwards and forwards to the brain and to the body. Now if the messages are in any way interrupted,
Yes.
right, aren't as effective, then something's going to
Yes.
happen, isn't it? Yeah? Okay? Now, another important sort of part of the body, which is interesting and people don't always appreciate, is this. If the brain is sitting in the skull and then comes down into the body, like so, just here, the lower part of the neck, because in the neck you have 7 vertebrae, in the lower part of the neck are the nerves that supply the hands and fingers.
Yes.
So if there's a problem in your hand, in your elbow, in your shoulder, it could well be that the problem is originating from the neck. Can you see that?
Yes.
Yeah? The same principle down here in the legs. Now we all know sciatica, we've heard of people or friends or family who have sciatic pain. Well, the sciatic pain could be originating from the lower back, because that is where the nerve starts. So pain in the leg could be coming from the lower back. Now there is another very, very important part of your anatomy which is ignored by a lot of people, and that is your foot. Now the foot is very, very important to what is happening to everything else above. And if we think about it, it makes sense. Because we know that if the foundations of a structure are sound, the structure will be sound.
Yes.
Yeah? And the foot is amazing, because the foot has 26 bones, 33 joints, excuse me, and 107 ligaments in each foot.
Okay.
A lot of stuff to go wrong. Now, this is a normal foot, and as you can see, it's got a beautiful arch in here, and it's actually 3 arches.
Yes.
And here, we have a flat foot, one that where the arches are completely gone. Now, what I have found over the 16 years of experience of sort of treating thousands of people is that not many people have what is classed as a normal foot.
No.
The majority of people will have some sort of kind of weakness in the arches, which will create some problems higher up.
Yes.
If you mind taking your shoes and socks off, and I'm just going to explain a little bit to you. So, if you just have a look at my foot here, please, if you wouldn't mind. So what you have here is you have a normal foot, and here you have 3 arches, and they are basically your shock absorbers in your body. So that when you walk, the heel goes down, the heel rolls outwards, you go across, and then you roll your foot back in, and you push forward through that part of your toe, big toe and little toe. And that's how you walk. When you have the arches there, your knee is kept in a straight line, and everything is cushioned and supported, and everything is as it should be. And that's all fine. But unfortunately, the majority of my patients, in my experience, and this is my experience too, yeah, is what happens is that generally people's feet tend to be like this. Now, can you see what's happening to my knee and to my leg?
Yes, rolling inwards.
Everything's rolling inwards. Now, when everything rolls inwards, now that is going to create tension in my knee and in my hip, all the way right up, sort of my spine, all the way up into the neck and the shoulders. And with every step I'm taking, I'm creating that tension into my body. But I'm also creating tension in my knee and in my hip joint as well.
Yes.
Okay? And the majority of people who are sort of, at the moment, pain-free will have tension in their body that they didn't even know was there until it's too late.
Yes.
Until it's too late. So what we do is we actually support the foot. Now, this is just one way of doing it. There are other ways, and exercises is another way of doing it, but exercises can take a very long time to affect the foot. And you cannot consciously hold the arch while you're walking. It's very difficult to do that. And barefoot walking is something which has become very popular these days.
Yes.
And by training the foot, right, on a regular day-to-day basis, months, years down the line, you can actually strengthen the foot, but it takes time and effort. And unfortunately, not many of us are prepared to do that.
No.
Okay? So let me just demonstrate something to you. So if we have a look at your feet, so if you just stand normally for me.
Yep.
Now you can see that with your feet, right, you have got a slight drop.
Yes.
A slight drop in the arch. So if I go under here, you can see that my fingers, please don't lift your foot up.
Yep.
Okay, you can see how my fingers, right, I can get about that much of my finger in.
Yes.
And get about that much of my finger in.
Yep.
Yeah? So there's a little bit of a roll in. Now that's creating sort of a little bit of tension in your body.
Okay.
So if we just feel the muscles, if I just run my fingers in here, can you feel how tight that calf is?
Yes.
Yeah? Can you feel how tight that calf is there?
Yes.
Yeah? And can you feel in here?
Yes.
Yeah?
Yes.
And then that in there?
Yes.
Yeah? So if I just turn you around for a moment, so if we just feel the large muscles in your body, so for example, these large muscles here on the side of your spine, can you feel the tension in there?
Yes.
Yeah?
Yep.
And if you just turn around for me, we're just going to do a little strength test now. So you're just going to hold your arms up there, and you're going to push up as hard as you can.
Okay.
And push up for me, hard as you can. Okay. Now, try again.
Okay.
Now, can you see how you're not finding it easy to hold up, are you?
No.
Okay? And why is that? Now, the reason for that is that because all your large muscles are tight, your core muscles, right, are having to work harder to hold everything upright.
Okay.
Okay, so your core muscles are firing properly because the strength in your shoulders actually comes from your core.
Yes.
Okay? Now, what shoe size are you?
7.
You're a 7. So if we just give your foot some support, just as you would any structure that's collapsing, the foundation is collapsing, you underpin it, don't you?
Yes.
Yeah, you support the foundation. Now, people who ride horses will understand this, because if the shoe isn't right, then the horse is going to have problems all the way up the body.
Definitely.
Right, builders will understand this.
Yeah.
If the house is subsiding and if they don't underpin it, right, it's going to keep collapsing.
Yes.
We obey the laws of nature just like everything else does. So now we've supported your arch, we've lifted your arch back up, okay? So if you push up for me now, hard as you can.
Yeah.
Okay, tell me what you feel, Sue.
I can feel it feels a lot stronger.
A lot stronger,
Yeah.
you feel more
A lot
stable.
more strength, yes.
A lot more stable.
Yeah.
And now if I go through those larger muscles, now you can feel how my fingers now are just sinking into your muscles, aren't they?
Yes.
Yeah? And you can feel here.
Yes.
Yeah?
Yeah, it feels completely different.
Completely different, yeah? Now, I haven't set you up for this, have I?
No.
No, okay? So, you know, this is something which is completely new to you.
Yes.
Yeah?
Mm-hmm.
Just swing your legs around, just keep your feet on there,
Yeah.
and just slide round. Okay, and
Yeah, they're not so
yeah,
tight.
feel that?
Yeah.
Okay, turn around and face me a second. So even though, Sue, right, you're active, you're
Yes.
doing all these exercises and everything else, can you see how your body, right, is struggling to maintain sort of a relaxation in the muscles,
Yes.
and sooner or later, right, your body will. Okay, great. So Sue, what what I'd like to do now is I want to go ahead and just do some tests on you,
Okay.
right, and just to see sort of how strong your body is.
Right.
Right. Okay. So if you'd like to just come and lie down for me on your back. Okay, and just lift your legs. If you just like to lift your legs up for me as high as you can, both together. That's great. And down again. Okay, and no pain and no discomfort at all.
No.
No. Okay. And I'm just going to lift this leg up. And that's okay.
Yeah, that's
Yeah.
good.
And that's okay.
Yeah.
Yeah. Okay. And I'm just going to test the shoulder strength and your
Okay.
arm strength. Okay.
Okay.
So push up for me hard as you can, Sue. Okay. And push up hard as you can. And what are you finding?
It doesn't feel that strong.
Doesn't feel that strong,
No.
does it?
No.
Okay. Turn your head towards me and push up again. And what do you feel?
Stronger.
Stronger. Turn your head the other way and push up. And what do you feel?
That feels weaker again.
Feels weaker, okay. Now, the reason for that weakness is, as we explained to you, as I explained to you sort of earlier, the nerve supply to the arms and the muscles in the arms comes from the neck, doesn't it?
Yes.
Yeah?
Yes.
So if that nerve is not firing properly,
Mm-hmm.
right, what's going to happen to the muscles in there? They're not going to get the messages, are they?
Mm-hmm.
Yeah? If they're not going to get the messages, then there's going to be a weakness.
Yes.
Yeah?
Yeah.
So, and you were totally unaware of that, weren't you?
Yes.
Yeah? So, let's have a little look. So if we push up for me, there's weakness. But if we actually go through your neck, push up for me, and push up for me. Now, that joint there,
Yeah.
how does that feel?
That hurts a bit.
That hurts a bit, yeah? So that joint is one of those joints that I said, right, is slightly out of place,
Yes.
slightly subluxated.
Mm-hmm.
So it's creating sort of a localized inflammation,
Yes.
which is aggravating the nerve,
Okay.
which is then, of course, creating that weakness in there.
Yeah.
But if I push that joint that way a little bit, so I ease the muscle tension by moving that joint that way a little bit,
Okay.
so I'm just reducing the impact on the nerve.
Okay.
Push up for me. Immediately, what do you notice?
That's much stronger again.
Much, much stronger,
Yeah.
isn't it? And I'm pushing really quite firmly now, and you're able to hold it.
Yes.
Yeah?
Yeah.
So can you see how important it is to make sure that the nerves are functioning properly
Yes.
and the joints are moving properly?
Yeah.
Yeah?
Mm-hmm.
Now, you were unaware of that, but
Yes.
rest assured, unfortunately, that sooner or later, with all your active lifestyle,
Yeah.
you know, when you were using that arm, right, all that would happen is that you'd end up with some kind of ankle pain.
Okay.
Yeah?
Mm-hmm.
And you mentioned the fact that you get some shoulder pain and stiffness in the mornings
Yes.
anyway, don't
Yeah.
you? Yeah? Let's try the other arm. Push up for me. And you can see that's nice and strong.
Yeah.
So really it is this side that's being affected
Okay.
more.
Mhm.
Okay? So I'm just going to test the other muscles. Push down for me, hard as you can. Very good. Push back for me, hard as you can. Very good. Pull down for me, hard as you can. Okay, pull down again. And you just can't do
No,
that.
that's a bit weaker. That's fine.
And that side you pull down. Okay, and that's nice and strong. Can
Yes.
you feel the difference
Yeah.
in the sides, yeah?
Okay.
And again, this is due to sort of stiffness right in here.
Okay.
Can you
I
feel that? Yeah? So push down now. So if we again take that to move that stiffness, can you see how immediately there's more strength in the
Yes.
body?
Yeah.
And now, the body needs to be working efficiently and effectively. When it's working efficiently and effectively, right, then hopefully, right, you can avoid any sort of aches and pains.
Yeah.
Yeah. You can also avoid sort of those wear and tear that sort of is associated with old age.
Yeah.
Because all wear and tear is just more pressure on the joint. So I'm just going to test your legs now.
Okay.
Now you mentioned the fact that you do yoga.
Yes.
Right, and that's every day.
Yes.
Yeah.
Yeah.
So you didn't expect that your arm to be that weak, did you?
No, I didn't.
No.
That's a surprise, yeah.
Push out for me hard as you can. Push out for me hard as you can. And can you see how there is this, you know, there's nothing?
Not much
Push out for me.
resistance there.
Push out. No resistance there at all. And yet, you know, there you are, physically active, doing all the exercises. And now, people who run, right, are just like that.
Yeah.
You know, they run marathons, they run all that, and yet, when we test them, right, we find them incredibly weak.
Yeah.
Now, the problem is that what is happening is that all they're doing is they're just grinding their low back spine away, and they're aggravating the muscles and their hips and their knees as a result of it. So sooner or later, they're going to have an injury.
Yes. Yeah.
Right, and then they're frustrated because they've got an injury, right, and then they don't have any treatment, they'll rest it, and then they'll go back out running again, and it will just keep making the problem worse and worse. If you stand up a second for me, please, sir. I want you to come and stand at the end and lie on your tummy. Okay, just lie on your tummy for me. Okay, I'm just going to pull you back towards me. That's it, perfect. And just get you comfortable.
Thank you.
Down. Arms by your side, please. That's brilliant. So if we just have a look down here, if we look at your leg length, we can see that your right leg appears shorter than your left.
Okay.
Yeah? And if I take it up, we can see that there's quite a difference between your right and your left, yeah? Now that is an indicator of some tension in these muscles right in here. So if I just push in here, what does that feel like, Sue?
That feels quite tight.
Quite tight and quite painful, yeah? Whereas if I do the other side,
That's fine.
that's fine,
Yeah.
yeah? So this joint in here is quite stiff.
Yes.
You're very, very stiff on this side of your body here.
Okay.
And then if I go up in here, can you feel that?
Yes. Yeah.
And in here,
Yeah.
in here, yeah?
Especially in the
See
middle
how
bit,
that, yeah, see how that muscle sort of, you know, I'm just sort of, it's like going over a thick cord, yeah? Whereas on this side, you know, it's quite soft.
Yeah.
And right in here, oof, yeah, those ribs are very, very tight, aren't they?
Okay, yeah.
Okay, sit up with it for me, please. Sue, thank you very much.
That's okay.
Now, as a chiropractor, right, I can see that there are quite a few things that are not quite working as well as they should do for you in your body. Now, as you said, right, at the moment, right, you're not experiencing any aches or pains.
No.
And the last thing in the world we want is for you to experience them.
Yeah.
Right? So one of the things that I would recommend for you to do is to have some chiropractic treatment.
Okay.
And the chiropractic treatment will involve us getting those joints moving, which will allow the muscles to relax, which will then allow you, right, to work even better with your body.
Yes. Okay.
And hopefully prevent any long-term problems.
Yeah. No,
Yeah?
that sounds good.
Any questions on chiropractic? Anything at all that I haven't explained that you want to sort of ask me on?
I'm just trying to think. I don't think there's anything particular. I'm just quite surprised at how tight the right hand side was, especially down the back. So
yeah,
it's made me aware.
And also the weakness in your arm as well and your legs. I mean, you know, even though you are, as you say, active, there's that weakness, and that weakness, right, can lead to a problem down the line. And this is what people must understand: is that pain is not what you should be waiting for. Yeah, because pain is horrible. You know, I've been there, I've had pain. And what we want you to understand is that if you come and see us without pain, but come as a preventative check, then not only is it sort of better for you, right, because you can avoid the pain, but it also works out to sort of better value as well, because we don't have to treat you as well. Because another question that we get asked is how often should I come? Or why should I keep coming?
Yes.
Yeah? So if I said to you, so that you need to come for a certain number of times, I mean, you want to know why, wouldn't you?
Yeah, of course you would.
Yeah, of course you would. Now the thing is that the question is your body has got into that position after many, many years.
Yes.
And we're not going to change it overnight.
No. Okay.
If you go to a gym, would you expect your muscles to get big and strong in one day?
No. No.
A week?
No.
Month?
No.
Maybe. Maybe. Yeah.
Few
But
months,
then
yeah,
a few months time down the line, then you'd notice the difference if you
Yes.
went to the gym
Yes.
3-4 times a week.
Yeah.
Right? You would notice the difference. Well, your body takes time to change back to the way it normally does.
Okay.
So yes, there is some commitment, right, to sort of get it right. But the rewards for you are immense.
Yes.
Because your body works better for you, you're not going to sort of hopefully have any aches or pains, and you're going to feel better for it.
Should be lovely.
Thank you very much indeed.
Thank
you.
you.
Thank you.
Thank you.